Hello, this is Friday, March 20th, doing a follow-up YouTube video from March 13th, last Friday, for Concierge Medicine of Columbus. I'm Dr. Jill Moore, recording from my home today as I've already left the office in an effort to let the nurses get out of there and get home and take care of business that they need to do. Just wanted to give an update for what we know in Columbus, Georgia area since the last video recording. To my knowledge, there is still only one confirmed positive case of COVID-19 in Muskogee County. However, there are suspected many others. We just don't have test results back just yet. From the several tests that I have collected myself at the office this week, the results are not returned as of the last few minutes before recording this video. I checked and there are not results back just yet. I do want to update you. There are some helpful treatments that we're considering to be available hopefully in the near future. Chloroquine is a malarial treatment drug, but that seems to be very effective in some cases for treating this viral infection. There's also a medication that was originally used for treating HIV that has been shown some very promising results here, and an influenza treatment in Japan has also shown some benefit. So we're looking to find what's the best medicine for our people in America to get treated for that. They're going to use it first, I'm sure, in the hospital setting for those, and may consider some for prophylaxis for those on the front lines between EMS and ER for those critical patients coming in requiring a hospital stay related to this. There's also some vaccine trials that are in early progress. It will take some time for enough of the vaccine to be produced, and then as many people, hundreds, will be vaccinated with that in hopes that it will give them some protection. But we won't know that it works until they've been exposed to the virus and then find out how many people catch or don't catch this virus after having this vaccine. We don't have any idea what dose should be used for this, and we don't know for certain any safety of this. We wouldn't want those people to have a false sense of security to go out and be around others accidentally spreading viral infection if they're asymptomatic. So I'm sure they'll keep a close check on these people who are willing to be brave and take this vaccine for us and find out if it will be effective or not. But I did want to share with you in general that I was very sad and somewhat disappointed in the number of people that I saw out shopping this afternoon. I had to stop by one of the big box stores after work today to try to get some supplies for our office. Places that I've been able to look don't have any Kleenex. There is no Lysol. There is no paper towels. There's no toilet paper. Our office is in need of such supplies, and I'll continue to try to find those for them. We need to be able to run our business still. At the medical office, we want to be able to see and treat our patients who need care. But I was very concerned about the number of seniors that were out doing what appeared to be casual shopping, and the number of families with small children that were out in this. As much as possible, please try to stay home, to only send one person in the family out into the community to be around this virus potentially. And as soon as you get home, clean everything thoroughly. I'm really concerned people aren't taking this quite serious enough. We do not want there to be a mandatory stay-home order, but that's something that they really might consider if enough people don't heed the warning and stay home. We saw some videos from those enjoying their spring break in Florida beaches and other places, and despite the warnings of this, people continued to go there and congregate in areas, and even some public parks in other cities were having concerning gatherings of people. So those have all been dispersed, and hopefully if your family members are looking for enjoying a spring break somewhere, the restaurants will be closed, the bars will be closed, there will be no congregating on the beaches. So unfortunately, a lot of people's vacation plans are going to be interrupted, at least for now. So please heed the warnings. Please stay home. For those of our patients, Dr. Hudson and I, if you were having difficulty getting medications delivered to you or in need of groceries to be delivered, please call us, and we have access to some resources that can help get delivery possible for you. But please do not go out into the community and think that you'll just be okay with this. This is very serious. There's a very limited number of ICU intensive care beds in our town. There's a limited number of ventilators. There is not unlimited resources for these. places are having a shortage of masks. There's a shortage of hospital gowns. There's a shortage of most every medical supply, that people are going through these much faster than before. So please heed the warnings. Do call Dr. Hudson and I. You have our number if you need to call us about anything. And we're trying to stay on top of this as much as possible. We will have access early next week to some rapid testing, COVID-19, that will take about 24 hours to get a test result back. So hopefully those will be available to us very quickly early next week for those who meet criteria for testing, either that they have significant symptoms of fever, shortness of breath, and cough, or if they have a direct exposure with one of those symptoms, they may also meet criteria for testing. So thank you for listening. Everyone, please stay safe and wash your hands. Thank you.